Thank you very much, everybody. Welcome to Project WaitWise. So we are a diverse group of software engineers and healthcare professionals, and also an innovation manager. So we are here to talk to you about delayed discharge, and our plan is to improve the quality of your discharge from hospital. This is a £2 billion problem. We'd like to start by introducing you to Agnes Murphy. Here she is. Agnes Murphy is a current inpatient in Craigavon Hospital, and she has just been told this morning on the ward round that she is allowed to go home. Agnes is 85 years old. She's a former professional show jumper, very interested in her horses. She has linked in with her daughter excitedly to say, yes, I'm ready to go home today, come and get me. Agnes can be picked up, she says, straight away. So Agnes's daughter arrives to collect her, and Agnes is there all day. 5 o'clock, 6 o'clock, 7 o'clock, you know the story. She links in all the time with the nursing staff, is getting increasingly annoyed, and finds out that pharmacy is the main issue and are delaying her medicines. So Agnes gets very angry and is advised by Sister that she is breaching the trust zero tolerance policy for anger against staff. So what are the existing solutions here? So we know that there's a MyCare app currently. We know that this is something that patients can look at, but there's nothing on there for patients or families to see where they are in the discharge process. We know for staff currently, the flow with Encompass and Epic focuses on flow through the hospital of patients, not on a patient-centred approach as to when is the patient ready for discharge. So for complex discharges, for example, that take time to organise, that may require packages of care, this is quite difficult for staff to coordinate within time.
So we wanted to get sort of the core root of the problem, and we looked at other industries and what they're doing to help wait times. So Rory Sutherland here talks about, often the pain of waiting is not the duration, it's actually the lack of information and uncertainty. So has anyone here used Uber Eats or any of these delivery platforms? So let's say you're hungry and you want your food, you're getting agitated, like, where's my food? What Uber trialed was, they actually told you what was going on. So it's in the kitchen, it's in delivery, and it's near your house. So this actually allowed people to be more susceptible to waiting longer because they knew what was happening. So that's kind of the inspiration for our solution. We built this app today with Lovable over the weekend, and you can see here we just have a little phone app where you scroll. It's got all the information. You've got an estimated discharge, you've got all the processes clearly outlined, and if there's a delay, it pops up as well, so you know why you're delayed, to allow you to plan. We also have a healthcare professional view, and the family can also look in, and this allows operational managers and other clinicians just to see where the bottlenecks are.
So we thought, what are the next steps? We feel like we can link in with the MyCare app that currently exists. We can use actually the patient wait time. So we're not saying we can reduce the wait time, but we want to make patients more informed about why they're waiting. And while they are waiting, we've also looked at building an education platform for them while they're there to improve health literacy. So we'll use the time that they're with us to do something different. We can identify, as Michael says, bottlenecks for patient flow and find out that maybe it's not just pharmacy, guys. Maybe there's something else involved. We think there is a clear pathway for funding for this. Who are the winners here? Patients and families. They've got reduced anxiety. We're going to hopefully improve health literacy. The multi-professional team, we've got better communication. We can have better discharge planning. Reducing patient frustration. We feel we'll also help bed managers to think about their flow and reduce readmission. And we want to say thank you very much for listening to us, and thank you for everybody who's helped us here this weekend. Thank you.
Well done. Oh, hands are up flying today. More of a comment on my part, just to clarify. I've researched, it's very rarely pharmacy.
I didn't even say that.
It may have something to do with survey design. Yeah. It may have something to do with survey design, which is retrospectively why was the discharge delayed, and guess what's the first thing on the list is pharmacy, so it's rarely pharmacy.
Yeah. Well, I didn't say that, but 73% of users in a recent survey said that the reason they were delayed from hospital was because of pharmacy.
That's what they're told.
Yeah. Thanks, that was really informative, really good. So I can see the patient-facing side, and you talked about the staff-facing side. What's the back-end data side that you're going to need to collect from the different departments? Have you thought about that?
Yes, we have. I'm going to hand over to the technical expert here.
Hi everyone. So yeah, we think pretty much, a lot of this information is going to be already in Epic. There's FHIR APIs available that we can use. Some hospitals have H7v2 feeds, again, that we can use. And, we want to, really though, what we want to do is not take an approach like has been done for other bed management type flow systems, which are all about administration and pushing people through. We really want the patient to be kind of informed in that journey. So, we can embed the patient view either in the My Health app, or we can have something like we were talking about earlier, where people like Pizza Hut and others, you could even share your status with your family with a short-lived code that basically they can access, and they can see how baked or unbaked you are as you go through your process. We really do think that the technology's there. That's not the blocker. It's actually the way that the current commercial products don't address the patient's needs and the family's needs first.
So again, it's sort of an extrapolation. Waiting in A&E, you can't even go to the toilet in case you miss your spot. And the Public Service Ombudsman says that the biggest problem is people don't know where they are on the waiting list. Is there an opportunity for that type of technology you've got to be used elsewhere?
Does anybody else want to talk?
Yes.
Go to the toilet in A&E.
Yeah, it's funny. There was gamification was kind of mentioned. I guess you don't want to go over the top with it, but I do think people understanding what the typical trajectory is for them. When you're using this data on bulk, we can actually predict and forecast, and we can take operational data from around the hospital, and so actually, we can use it anywhere where there's effectively handoffs and queues. If you start surfacing that data in a more intuitive way and forecasting, you can kind of almost show the burn down towards being seen or being discharged or being moved around. So I think it is applicable in different settings.
Can I just say, I think that this is a very necessary sort of intervention. Okay, there's a lot of anger and frustration, and staff this winter are going to be dealing with a lot of very difficult situations. I also think there are points within the discharge journey where patients could go home.
Yeah.
And also that if this allowed patients to have that choice, that you could actually go home now and you could come back for your medicines,
Absolutely.
or you could come back for that test, or that test could be communicated to you in another way.
Thank you very much, everybody.